If you see our sanitation coverage in the country, 1981 it's just 1% only. When Honorable Prime Minister launched the SBM program, the coverage was less than 35%. 2019, October 2nd, we reached 100% coverage both in rural area as well as urban area. So after achieving individual household toilet coverage, then we moved to SBM 2.0 because we have constructed toilet. What will happen once the pit is full or the septic tank is full? So we need to address the safely managed sanitation aspect of it. That's what the Government of India launched SBM 2.0 both in urban as well as rural as well. So in the SBM 2.0, the major focus is on community and public toilet focus as well as the grey water and black water management. This is a major focus around. Maybe after launching 2.0, SBM 2.0, if you look at the Government of India, the particular urban status, there are about 4,355 statutory towns. Nearly 81% of the towns achieved ODF plus status, meaning so the people access to household toilet are either household toilet or public or community toilet. And the second aspect of it, all the public toilet and community toilets maintained well, sustainably, and O&M system set up, and also maybe the bag and design, whatever the sludge coming out, that also get treated. This is the SBM ODF plus. ODF plus is something different, that is maybe completely safely managing sanitation. That means maybe extracting the fecal sludge from the septic tank or leach pit, safely transporting and treating it, safely disposing of. This is the ODF plus status in the case of urban area. In the case of rural, SBM 1 is focusing about 5 different components. That is, one is focusing around solid waste management, second is grey water management, the water which comes out from the kitchen and bathroom, that is called grey water, the black water management, the water comes out from the septic tank, it's called black water, and also maybe the plastic waste management, cattle waste management, that promoting biogas. These are the 5 different components comes under ODF. So if we look at the rural achievements, nearly 5,17,000 villages achieved ODF plus status. This is a greater achievement within a span of 3 to 4 years. If you look at the Government of India statistics, particularly for the National Family Health Survey, it happened 2015-16 of 19 to 21. If you compare these two data, it's clearly indicating that there is a reduction in diarrheal diseases, particularly countrywide nearly 1.9% reduction. There are states like Uttar Pradesh and Chhattisgarh, Tamil Nadu and all showing greater impact due to the sanitation coverages. So it's a lot of impact around health, particularly for waterborne diseases. WASH-related diseases can be classified into 5 different categories, particularly waterborne diseases, mainly because of fecal-oral contamination. Fecal contamination lead to waterborne diseases like diarrhea, dysentery, cholera, jaundice, typhoid. These are all waterborne diseases because directly consuming contaminated water. So which we have prevented by constructing toilet, access to toilet, prevent these kind of things, particularly for fecal water transmission route get eliminated. That's a major achievement. Second thing is lack of sufficient water, keep ourselves clean. That's called water washed diseases. If there are lack of water, you can't keep yourself clean. Then that lead to certain diseases, particularly for scabies and skin diseases. This is water washed diseases. Water-based diseases is the third category, where people sometimes dip or take bath in maybe contaminated water like pond or well. So through which you get certain diseases called schistosomiasis and guinea worms. These are the diseases, but guinea worms eradicated in the country long back. Still here and there are cases of schistosomiasis. Fourth one is water-related vector-borne diseases, mainly because of mosquitoes, right? The water, because water stagnation, both fresh water as well as black water or maybe dirty water stagnation, through which the mosquito breed and spread the disease, malaria, dengue, chikungunya. It's all the mosquito which breed from the fresh water. The filaria is the spread the mosquito which breed from the dirty water. So definitely, because your grey water management, black water management through the SBM 2.0, we are addressing that issue as well. The other one is soil-based diseases. You are not going for a open defecation. Open defecation lead to certain diseases because it's there, the soil media. When you are without chappal, you are walking, then you get hookworm, pinworm. These are the soil-based diseases. Likewise, you can categorize the water-related diseases in different ways. Particular state Uttar Pradesh indicating that the reduction of diarrhea from 15% to 5.5%, nearly 9.4% reduction there. Like Tamil Nadu is showing a nearly 4.5% reduction, and Chhattisgarh is showing nearly 5.5% of reduction of diarrheal diseases. So it's not only that, there are global studies maybe by WHO, UNICEF and Bill and Melinda Gates Foundation studies also within the country indicating that there's a considerable reduction in waterborne diseases in the countries. Source segregation is a critical element. So maybe each and every household we need to practice segregation of waste our house itself. So this is again our citizens' responsibility. And maybe plastic waste management, government is promoting a lot of advertisement, lot of behavior change communication. But then we need to practice. When you go to market, we need to carry our own bags and things like that, right? So we should not, maybe we should avoid using single-use plastics. So then maybe while you are constructing new houses, maybe people should follow proper norms for construction of septic tank or twin pit toilet. And maybe so it is a citizen responsibility that the septic tank need to be, as per the design, it 3 to 5 years interval, it should be emptied. We need to make sure that so it's getting emptied. Although it is more than the government, government is provided, the created awareness, created behavior change communications, provided a lot of infrastructure support. At the end of the day, we, the citizen, we need to take the responsibility to sustainably manage, maintain our infrastructure. If you look at the fecal-oral transmission route very clearly, right? So there are two aspects considered as a primary barrier. So that is, one is using toilet, the second is hand washing, right? Even if you use toilet, hand washing is critical. At critical occasions, you need to wash your hands properly with the soap. That's what the WHO reports earlier, the world reports are very clearly indicating nearly 42% of the diarrheal cases can be simply avoided by using hand washing with soap. So maybe I would say that maybe personal hygiene you focus, maybe all personal hygiene, combing hair, maybe taking bath and using good clothes and all there. The critical aspect is that hand washing, so which will prevent from diarrheal diseases. So that's the area I would say that maybe focus on toilet usage and wash your hands. This is a primary barrier.